The Biden administration is still pushing ahead to get adults vaccinated as the deadline of having 70% of adults getting at least one shot of the COVID vaccine approaches. Dr. Rosha McCoy with the Association of American Medical Colleges joins us this morning to talk a little bit more about the efforts to get more adults vaccinated, as well as the risks of being unvaccinated. Good morning, doctor. Thanks for joining us.
Good morning. How are you?
Great, thank you. So let's talk a little bit about the percentages. Right now, 46% of adults are vaccinated. We tried to get to 70. What exactly needs to be done to increase that?
Well, I think we really need to start realizing that the remaining population are folks that we do have to work harder with and have to build confidence in the vaccines. There are a number of things we have to do, and we just have to keep finding solutions to the issues. I think we need to start taking the vaccine more directly to people, making access even easier. The folks who came to mass vaccination sites, et cetera, were the early population who wanted the vaccine and were already pretty confident. Now we need to work on getting the vaccine to folks directly, more directly, taking it out to them, working with primary care doctors and other physicians in their offices, going to community sites where folks gather and getting the vaccine to folks, making it as easy as possible. And I think we just need to continue to listen to the concerns folks may have and make sure we're sharing accurate information with them. So it's just going to continue to be a learning process for all of us, listening to each other and making sure we're giving the information about how important the vaccine is. This is the only way we're really going to get out of this pandemic.
Right.
It's really only the unvaccinated folks who are getting sick now, so we need to get to them.
Right, and talk a little bit more about those who are unvaccinated and especially the concerns with the new Delta variant. And what would you say to folks who might still be weary about the vaccines given the new risks that have popped up?
Well, the new risks for young people are there. They're very rare. All of the young people who've gotten sick with the rare heart conditions have all gotten better. And so the risk of the disease is still much higher than the risk of the vaccines, much, much, much higher. The folks who are getting hospitalized and dying right now from COVID-19 are all unvaccinated folks. These deaths are preventable. We have to make sure people understand the risk of this virus. The other issue are the long-term complications. We're getting more and more information that folks who get the infection, even those who are not hospitalized, can have breathing issues, other kinds of neurologic issues, pain issues. So we really need folks to understand the risk of this virus at this point and make sure they get the very effective vaccines that we have available.
Dr. McCoy, what happens if we stay at right around 46% of our population vaccinated?
Well, it does increase the risk to everyone. I think the other thing you have to realize is that there are people who have gotten the vaccine for whom the vaccine doesn't work quite as well. Older folks, people who are immunocompromised. So really, those who are not getting vaccinated are leaving all of us more vulnerable and more vulnerable to the variants. So that the more virus that is out there, the more likely it is going to change again. And so we really need to race against making sure we get people vaccinated and have people understand the importance of this vaccine and the risk to them and to their families.
Right. Probably one of the most important races in our lifetime. Thank you so much, Dr. Rosha McCoy with the Association of American Medical Colleges. Thanks for joining us this morning.